Today, I want to talk about something that's really serious, and we know that diabetes is very dangerous to the body, but have you ever heard the term that diabetes is known as the silent killer? What this means is that many individuals who have diabetes oftentimes feel fine until one day they get into some sort of dramatic emergency state. They have a heart attack, they have a stroke, or being told, hey, your kidneys are now failing, you have to now go on dialysis, or things like neuropathy that can lead to amputations that can also increase the risk of major infections that can cause an early death as well. So the one thing about diabetes is that it can link to multiple ways of an early death. The most common type 2 diabetic early death situation is due to a heart attack or a stroke. So let's start with that one, right? The first one we know that it leads to is a number 1 heart attack or stroke. This is the leading cause of diabetes, death of a diabetic. Roughly 66% of type 2 diabetics will have a heart attack or stroke at some time when they're dealing with diabetes as it's progressing over time. So that's a very high percentage, right? Almost 3/4 of diabetics can have a heart attack or stroke. It's the number 1 cause of death. So what are some things that you need to be looking out for? Yes, you can look out for the common things like elevated blood pressure and cholesterol and things like that. But again, those things are commonly just potential risk factors. They're not increasing or showing the increased potential scenario of a stroke or heart attack happening. So I want to give you some markers or some identification things you can look for on blood tests that you can ask your doctor to run, or at least make sure they're running them on a regular basis to show a potential risk of that happening or not. So obviously, you should still be looking at things like LDL, right? It's what's called your bad cholesterol. It's the cholesterol that's being released by your liver, entering your body, and when you have high amounts of this, it increases the risk of it sticking to the arteries and causing clogging. So this is something you're probably being evaluated for on a regular basis, but that's something I wanted to mention. Of course, it still needs to be ran. But some of the other ones that you're not being looked into, this one is called C-reactive protein, or CRP, specifically to the cardiac. This marker right here is a valuable marker. This is the best predictive marker we have in science for potential heart attack or stroke. Not the risk factor, but actually you having a heart attack or stroke. And what the science tells us, if this is higher than 1, your risk factors are increasing. If this is higher than 3, if it's worse than 3, you're at a very high risk. So I've seen individuals in the 10s, 12s, 20s, even 50s before, essentially walking around with a major risk of heart attack, even though their LDL was not high, right? So this is a very, very good predictable marker, needs to be evaluated. The next one we look at is called homocysteine, another very important marker. These two right here, the CRP and the homocysteine, are referred to as inflammatory markers. And remember, inflammation is like fire, right? And what does fire do to anything in its path? Burns it, destroys it, right? It's very damaging, but these markers are evaluated in your arteries. It's arterial inflammation. And homocysteine, what it's been found is if it's greater than 7, not only is it indicating your risk for heart attacks and strokes, but more importantly, it's a risk factor for type 3 diabetes. Remember, type 3 is referred to as Alzheimer's and dementia. So this is another one. These two should be evaluated every single time. If you're not being evaluated for these, make sure you're asking your doctor for this. This is very important for your potential risk factors that are going on into the system. So these right here are very important ones that are common ones you can get on a blood test. But another one as well, if you ever have a situation where your LDL is high and the rest of these are not very high, and your doctor says, we want to put you on cholesterol, ask them to do what's called a calcium score, because a calcium score will indicate your risk factors for a heart attack by how much clogging or blockages is happening in your cardiovascular system. Because if you have high LDL and your calcium score is normal, then your risk factors for heart attacks and strokes are very low, and it may not be a reason for you to be put on cholesterol medication, because cholesterol medication has a lot of negative benefits or negative impacts to your body. So these are major things you can evaluate. And there's more in-depth ones as well. Someone who has a lot more education who's watching this is probably saying, well, there's more you missed, but these are easy ones that can be done and evaluated by your current physician, as long as they're willing to run the test and your insurance is willing to pay for these to see your risk factor for a heart attack or a stroke. This is very important because these things could be happening under the surface. They're going high and you may not even be experiencing the symptoms of it. Don't wait until the symptoms occur. Remember, when the symptoms that commonly are known with heart attacks are things like arm pain, jaw pain, rapid heart rate, maybe chest pain. Those are not symptoms of a heart attack coming. That's the heart attack already happening. This is very important that you really know the difference between the two. So this is number one. Number two, we want to look at your kidneys, because remember, kidneys, the number one cause of kidney disease is type 2 diabetes. And there's some markers that you can look at on your blood test to identify, is there some potential risk for kidney damage that are going on? One of those markers that we can look at is called GFR. This stands for glomerular filtration rate. It's an indication of how well your kidneys are actually filtering, because that's the main function of your kidneys, to get things out of your body through urine. So if this is not working properly, it's indicating you can't get things out. And if you can't get things out, they're staying in your body, causing more damage and more issues. When your GFR goes lower than 85, this is called stage 2 kidney disease. This is easily can be evaluated on Google if you want to look at the different stages of kidney disease. Below 85 is stage 2 kidney disease. Now, typically in the medical model, they're going to wait until it goes below 60 before they start saying, okay, there's a problem going on here. You have a kidney problem. Why? Because this is considered stage 3. There are 5 stages to kidney disease. In many cases, there's not a lot they can do because there's not really any pharmaceutical medications to give you to help you with your kidneys. But this will progress over time until this goes below 15, below 15. And when it goes below 15, that's when you start to get into a situation where you're now in dialysis. And this is where it gets really serious, because once you're on dialysis, in most cases, you're not coming off that dialysis unless you have a situation where you get a kidney transplant, but now you're going through all that mechanism there. So when we come back to the situation here at the kidney scenario, the kidneys are the first thing that we want to evaluate, but it's the GFR. Look at your GFR. Above 85, you're good. Below 85, it's a problem already happening. Below 60, the problem is getting worse. Below 15, then this problem is really severe at this point, and you're now on dialysis. The next one you can look at here are your other markers, BUN and creatinine. Your BUN ideally should be between 13 and 18. And your creatinine should be between 1.1, never higher than 1.1, never higher than 1.1. So 13 to 18 for your BUN, creatinine 1.1, never higher than 1.1. The reason for this is because it's an indication of function for kidneys. If you're beyond that, your kidneys are not functioning optimally. The last thing you want to look at in regards to these major functions is neuropathy. If you're experiencing symptoms of neuropathy, numbness and tingling, burning, etc., even in the early stages, the problem is developing. Don't wait until the problem gets out of control where you're like, now I've got to go get some stuff done. Find out what that is. Minor tingling or numbness is just as bad as the problem getting so bad where you have to have an amputation. Don't wait until this progresses and gets worse over time. So these are the 3 key factors that you need to be evaluated. Number 1 for heart attacks and strokes, the number 1 cause of death of a diabetic. These specific areas, LDL, CRP, homocysteine, and calcium score are common things you can evaluate to see if your risk factor is increasing, meaning you don't have the symptoms yet, but this could be creeping up on you and one day get out of control. The kidneys, and evaluating your kidneys, you can look at your own markers to see if some of these things are going on. Neuropathy, I just wanted to focus on if you're experiencing the symptoms of neuropathy. I don't care if it's from very early stages or getting worse, because the outcome of neuropathy as it progresses, once that snowball gets worse, is amputation. You don't want to be at a place where you're having to amputate. I've had that happen before. Someone came to my office looking for help, and essentially they were getting a foot amputation within 30 days. There was nothing I could do. It was too late. So some key factors again, the type 2 diabetes, the silent killer, cardiovascular risk, kidney risk, and neuropathies are the biggest ones. There's obviously a lot others as well that are out there. Those are the major ones we commonly see in our practice. So hopefully this helps you to look at more about what you're going through and identifying early situations that are happening for you to start making some changes. All right, you guys, thanks for joining us today. Make sure you join us for next week where we go over more detailed information about how we can help you reverse your diabetes. Take care.